Welcome to KidzDocTalk with Dr. Jennie. Today's guest is Dr. Jamilah Grant talking about complementary and alternative medicine. Dr. Grant earned her MD from Boston University. She has been a board-certified pediatrician for 30 years and has worked in academic medicine and as a pediatric hospitalist. Dr. Grant developed and directed pediatric clerkship at Hofstra University and has now been the lead physician at Pediatric Associates Fort Lauderdale South location for 5.5 years.
Welcome to KidzDocTalk with Dr. Jennie. Dr. Jennie is a board-certified pediatrician and is the director of telemedicine at Pediatric Associates.
Hi, Dr. Grant. Thank you so much and welcome.
Thank you, Dr. Berkovich. I'm glad to be here.
Good. All right. I'm excited to talk about this, what I think is a fascinating topic and one that I have to be honest, I don't know so much about, which is complementary and alternative therapies. So before we start talking about them specifically, let's just get oriented. What are some common alternative treatments that you see patients and families use?
So many treatments patients and families or families have been using for generations, and they can vary from culture to culture, family to family. Some of the common ones, certainly elderberry, especially these days for colds and flu, ginger for colds, ginger root, colds, upset stomach, nausea, probiotics for sure, when children have upset stomach or stomach bugs, stomach viruses. Hemp oil is used pretty frequently now, not so much in children, more in adolescents and adults, I think. So that's just a handful.
Okay, so you mentioned elderberry, which I feel like has been coming up a lot recently because, right, we have lots of colds and viruses and COVID and all of that. So what are, I'm assuming elderberry is like, that's the main thing that it's used for, but what are some like common conditions that these therapies are generally geared towards?
So most commonly, these come up with colds and flu, but there are other conditions such as neurologic conditions, migraine headaches, epilepsy or seizure disorders, acne, rashes, as I mentioned, stomach upset. There are certain therapies commonly used for side effects of certain medical therapies, for example, chemotherapy, nausea, and so on. It's just a few.
So we'll get into specifics of like which of these things are like actually helpful versus maybe not so much. But I find that people tend to be very liberal when it comes to like trying all sorts of these things, thinking that, well, the worst thing that it can do is maybe like it doesn't work, right? Or like maybe just it's not helpful or it's placebo, and best case scenario, it will actually help. But is that really the reality, or are there maybe some harmful effects that we need to be aware of with these types of therapies?
Yeah, that's actually not the reality. And people need to keep in mind that natural does not equal safe necessarily. Just because you go into a store and it says all natural or homeopathic, or just because you can go in your yard and see a certain plant growing and boil it with, that doesn't necessarily mean it's safe. In fact, some can have very harmful side effects.
Anything specific that, at least like from the list that you shared, any specific harmful side effects that people you think may not be aware of?
Yeah, absolutely. So elderberry is generally considered safe in small amounts and if it's processed correctly. So raw elderberry can actually be toxic if it is treated with heat. If it's cooked or boiled and processed a certain way, it's considered safe. There's some evidence, but it's not great evidence, that it can decrease the duration of colds and flu. So it's, like you said, it's widely marketed right now, but in certain forms, it can be unsafe. Things like hemp oil. Hemp contains omega fatty acids, which can prolong bleeding. So people need to be aware of that, especially if children and the same thing goes for fish oils. Fish oil is another big one that's out there, especially cod liver oil. People have been giving their kids cod liver oil for ages. I had to take cod liver oil when I was a kid. So every winter, but it can prolong bleeding. It can cause gastrointestinal or stomach and intestine problems. And it can cause complications if children are undergoing surgical procedures. Other commonly used therapies or complementary alternative therapies can interfere with medications given for sedation and general anesthesia. So all of that has to be kept in mind.
And there's also some potential for interaction, right? Even if you're just taking routine medications. I remember learning something about St. John's wort, right? Being potentially, right, interacting with oral medications. Is that also a concern?
Yeah, that's true. And also with sedatives and general anesthesia. It can interact with certain antibiotics. It can decrease the efficiency of certain antibiotics. Let's see here.
So all kind of important things to keep in mind, but what about some medications or I guess, alternative treatments that people may not even realize are alternative treatments. So the first thing, the first thing that came to mind was like something like melatonin, right? I find that is so widely used that somebody may not even realize that's like an alternative therapy. It's almost like Tylenol, right? Like we don't think of that as an alternative therapy. It's available over the counter. It's recommended. Like what could be unsafe about it? But there are some safety profile concerns with something like that, right?
Definitely. So with melatonin, with most of these alternative treatments and naturopathic or natural treatments, there's ongoing studies. I won't say there's studies for most of them, but there are many ongoing studies right now. There's some evidence that many of these may be effective, but the studies are generally small and it's not great evidence. Promising, but not great. Melatonin, most of the information seems to be anecdotal at this point. It's just like the experience that people have had, the experience that certain practitioners have had. More neurologists are starting to recommend it now for sleep problems, especially in predisposed children who might have neurologic issues, ADHD, who may be on the spectrum for autism. Those children are more predisposed to sleep issues and other children with chronic illnesses that cause discomfort, like severe eczema. Right. And so some specialists are starting to use melatonin. There's no evidence as far as what a safe dose is for children, and even the dosage that we see, much of it is anecdotal, like what's been used in certain populations and hasn't seemed to cause any problems. For example, in Canada, there's certain doses that are just like, marketed, and that's the way they're used. And so we kind of go according to that. And every specialist has their own experience with it.
So that's what I always tell parents, like when they ask for a melatonin recommendation, I'm always a little bit at a loss because I find that the recommended dosages are kind of arbitrary. Like it comes in 3 milligrams, right? But why? And there's also I also always have this concern since it's not regulated, right? None of these things are actually regulated by FDA, things like that, right? So the dosages that 3 milligrams of one brand doesn't necessarily equal 3 milligrams in another brand. And that always gave me some pause.
Exactly. So the concentrations can vary. And you're right. These are marketed generally as dietary supplements, and they don't require FDA approval or regulation. They can, the marketers or the manufacturers can make certain claims or misleading claims that aren't necessarily regulated. So one has to keep that in mind with all of these, especially dosing when it comes to children. There's more even anecdotal evidence supporting certain dosages in adults, but not necessarily in children. And women who are pregnant or breastfeeding also need to be very careful about these products.
So we talked about elderberry, we talked about melatonin. I want to talk about probiotics a little bit because this is something that has sort of, I feel like the pendulum continues to swing, and I'm not sure how I feel about it. When I was in training, we used to put a lot of kids on probiotics. Anybody that was like admitted for dehydration, right? Any kid we saw in the clinic for diarrhea or a viral gastroenteritis, we would always recommend probiotics. And then when I got out to practice, I found that wasn't necessarily like evidence-based. I don't know that there was like a ton of sort of solid information or solid proof, right, that it helped shorten the duration of diarrhea. Where do you stand right now in probiotics? Like, what does the evidence show? And is it ever harmful?
Well, there is some evidence now. It's not, and again, these are ongoing studies, but there is some promising evidence that it can reduce the duration of certain gastrointestinal illnesses, for example, viral gastroenteritis, vomiting and diarrhea. There is even better evidence that probiotics can prevent antibiotic-associated diarrhea. More evidence growing now that they can prevent certain complications in premature babies, like what we call necrotizing enterocolitis, which is a very serious intestinal infection that premature babies are very prone to, and also even sepsis in premature babies. As far as, I've been a hospitalist for a long time, and even admitted children, infants and children who were admitted for vomiting, diarrhea, dehydration, it's become in many institutions a pretty routine thing. We just put them on certain probiotics, as part of their regimen in the hospital. So there's growing evidence that it can be effective in reducing the duration of these illnesses. There have been some reports of probiotics having been linked to serious bacterial infections, particularly in very immunocompromised children and adults, people with very serious illnesses. But those haven't been proven. It's more of a matter of these products being linked to those outcomes. And so the investigations are ongoing.
Okay, so sounds like probiotics was sort of, one of those things that falls into the category of things that we think might work, right? What else lives in that category? Things that we think might work.
So cranberry, right, for urinary tract infections.
Yeah,
people need to keep in mind that cranberry has not been at all shown to treat urinary tract infections. There is some evidence from some small studies, but pretty promising, that cranberry products can reduce the frequency of urinary tract infections in those patients who are prone to them. But you have to keep in mind what type of products these are. So these studies have been done mainly with cranberry extracts or concentrated properties from the cranberry, not necessarily like ocean spray cranberry juice, which
has a ton of
water
sugar,
and sugar.
Right?
Like water and sugar and maybe a drop of cranberry in it. So that's another thing. What else? Let's see. We talked about elderberry, probiotics.
You mentioned ginger. Is that that I feel like that seems pretty safe, seems pretty natural.
Yeah,
helpful at all?
It has been shown to be helpful with nausea and stomach upset in some small studies. And again, most of these studies are really small and they don't have the greatest evidence and p-values and etc. And just like anything else, too much of it can be harmful, the same way that it can help with certain intestinal issues and nausea. It can actually cause these problems as well. And for all of these products, you have to keep in mind that some people may be sensitive to them. You can have allergic reactions, either ingesting some of these products or even using them topically.
Is there evidence for anything that we know absolutely does not work? The thing that came to me, like initially, things that came to mind was gripe water, which I hate, even cringe saying the word gripe water because parents love it, and it's one of the things that I detest strongly. I'm not sure how you feel about it, but what else kind of lives in that category?
So as far as being proven not to work, there's nothing that I know of that's been absolutely proven not to work. But there are plenty of things for which there's no evidence that they do work. For example, gripe water.
Yeah.
The thing about gripe water is from one source to the next, you don't know what's in it. Some of it is chamomile extract, which, okay, chamomile has been shown to be pretty safe. We don't know how much of this extract is in it. There have been some that have been pretty recently taken off the market, gripe water and treatments for colic that contain belladonna or deadly nightshade. As a matter of fact, about 10 years ago, there were parents who brought this a container to me. I don't remember what the brand was, but they were concerned that the baby was really pretty out of it after using this, and it contained deadly nightshade, belladonna.
Yeah, that'll make the baby out of it.
Yeah. Stop the crying for sure.
Yeah.
But and then depending on where they're sourced, the manufacturing may not even have sufficient oversight, so that if they're coming from other countries, they can be contaminated with other products and even trace metals. Some of these have been shown to contain lead and other toxic substances. So when people ask me about gripe water, I generally just say, no, please don't use it.
That's generally my approach also. So I think my main takeaway is just, be very cautious and consult with the medical provider before pursuing any kind of alternative therapies. Any major pearls, like what's the one thing that you want parents and families to know about these types of treatments?
Main thing, natural and growing in your yard does not equal safe. And when you go to see your practitioner, your provider, make sure that your provider knows everything your child is taking, because we may prescribe certain conventional medications that could react poorly. For example, people grow cerasee. Cerasee is called like a bitter melon. It's very popular in the Caribbean, and it grows every place here in Florida. I've discovered it's growing wild in my own backyard. It generally goes by the name bush tea, and people will, just give it to their children or take it themselves in a tea once a year, twice a year, just to give themselves a good clean out, because it can cause diarrhea in large amounts. So they'll use it for that. But it can be hepatotoxic, and even giving it with medications that are metabolized through the liver, like Tylenol, can cause serious problems. So we really do need to know everything your child is taking, not just what's, the conventional over-the-counter medications or what's been prescribed. Things that, your auntie or grandparents may be giving, things that, you may not even know fully what the names of them are, but just give us an idea, because it's really important, and it can prevent serious or poor outcomes.
I think that's a good reminder also for, like, as a general pediatrician, right? When we ask about any medication that the child is on, to also review any, this kind of stuff, like natural supplements, right? And things like that. Because I don't know that I always ask about that. And I wonder how much of the history I'm missing, since a lot of these things can actually cause the symptoms that we're trying to get rid of.
Right. Home remedies are very important to know about. And also take time to educate your older children and adolescents, because they can get their hands on a lot of these things. And there's a lot of marketing that's being done toward them, especially in sensitive areas for teens, acne, muscle bulking, and so on, claims that they can make you taller or just bulkier and more handsome, more beautiful. Kids are getting these things on their own, and parents may not even know about it. So
that's a great reminder.
It's important just to make sure you educate and talk to your kids about these things.
Well, thank you so much. This was outstanding. I learned a lot, and I would love to do like a follow-up discussion to get a little more in depth, I think, specifically on like muscle supplements and things like that, because I do think we see a lot of patients with this, and probably seeing some not great outcomes from it.
Absolutely. I love that.
Thank you.
Make sure you like us on Facebook and follow us on Instagram and Twitter. Thank you for joining us on KidzDocTalk.